Today on the Dr. Oz Show, and the miracle procedure to laser off your fat in minutes without surgery.
We guarantee 3 inches at least.
Next.
What if I told you this cutting-edge device could melt inches off your waist and keep them off for good? Well, today, I'll show you live on the air the miracle procedure to fight fat without undergoing the knife. Joining me is Dr. Jamie Heskett. She's performed this procedure on thousands of her New York City patients. Dr. Heskett, welcome to the show.
Thank you.
So, the device is called Zerona. Talk to me about how does it work? What fascinates you about it?
Well, I'm really excited to share this machine with you. It is the new frontier in fighting fat and getting rid of unwanted inches. So Zerona, actually what it does is a cold laser. It perforates the fat cell. When the fat cell is perforated, the contents of the fat cell leak out. They're taken into the circulation. It's either metabolized by exercise or by the liver, and the fat cell shrinks. And you shrink.
How many of you want to get your arms under here right now? Would you? A lot of you? All right. Let me perform, just informed consent. I'm going to show you with an animation what this actually does, because we have some really cool footage, and then we're going to talk a little bit about how it might be used in your lives. Okay, so here's what happens. You got an animation that sort of brings this alive, because it starts with the skin, but there's all the fat that you have, and the laser goes through that skin, and it hits the fat cells. Now let's actually see what really happens. Your fat cells literally dissolve. You see this shrinking up, and as they become mush, they begin to spread out and dissolve. Now what really happens is individual cells get messages. Once they have that signal, your white blood cells see those little sticky things come in there, and they suck them up, and you know what happens? The fat shrinks.
So what we love about this machine is, and this new technology, is what we call the Zerona trifecta. And that is non-invasive, it is completely painless, and most importantly, it does not destroy the fat cell. We know that the fat cell is important to the endocrine function of the body, and we also know that if you reduce or take away the fat cells from the body, then if you are to gain weight in the future, it's going to potentially go to an undesirable place.
Right.
So that's what makes this different than any other technology that has been available in the past, or any procedure that you can do that's invasive.
Perfect. So I'd like you to meet a woman who may be just like you. She's tried everything to get rid of those extra pounds, but nothing seems to work. Until maybe now.
My name is Catherine. I'm 48, and I am stuck. I have actually named my belly fat. This is my fat cat. Fat cat, it's time to leave the building. I mean, come on. I just can't take this anymore. I mean, I have been trying to lose weight for years. This sucker is not going away, and I don't know why. I have exercised, I eat right, but nothing is working. This is my diva dress. I have this dress that I bought a couple of years ago. I know, sexy, right? I am dying to fit into that red dress again. Oh, I used to feel sexy. I'd walk around in my little short skirts, but now, it's not happening. There's a skinny diva in this body. there really is.
Catherine, thank you for joining us. So, not many women actually name their fat. And I could see how you're sort of connected to it, and we're thinking about it a lot. So, Dr. Heskett, let me ask you, as a physician, how do you know if Catherine's a good candidate for this? And just help everyone understand who might actually benefit from the procedure.
So, Catherine is a great candidate for this because she is committed to a healthy lifestyle. So, for her, this is going to jumpstart her weight loss program, which was before an insurmountable challenge to her.
You ready? You psyched?
Yes, I am.
Slide on back here. Watch your head.
Okay.
There you are. Watch your head. Watch your head. Good. Okay. Slide up a little more. And I'll put these goggles on you. Now, this is a laser device, so just out of etiquette, we put glasses on. But they look good on you anyway, Catherine.
So do you feel anything, Catherine?
Oh, no, nothing yet.
So take us through the steps.
Yep, so we're just going to expose the area that she wants to reduce.
All of this.
Yep, all of this.
Catherine, that's your whole body.
Oh, okay.
She's going to disappear on us. She's gone.
Now, even though we're only focusing the laser for Catherine on her belly, she's going to lose inches everywhere because the fat cells have this beautiful capacity to communicate with each other. And I can guarantee that she can lose at least 3 and as many as 11 inches in 2 weeks, which is
11
huge.
11 inches?
Huge.
I mean, where do you lose 11 inches? Most people don't have 11 inches to throw away. There's intestines in there.
Correct. She's not going to lose 11 inches from the circumference of her abdomen, of course. We're only limited by, you see these probes here, where they can actually reach.
Catherine's smiling so widely she's going to get wrinkles. All right, talk to me about how much of an investment is cost, time.
Okay, so it's the protocol is 6 sessions. You typically do it over a 2-week period, Monday, Wednesday, Friday. You can find this treatment is available all across the country in multiple different types of situations, like doctor's offices, health spas, etc. Generally, the cost is between $2,000 and $3,500, obviously depending on where you live. Yeah. It's a 40-minute session, 20 minutes on each side, and you're out the door.
All right, you still no pain?
No, I'm fine. I wasn't even sure it was starting.
Most people sleep during the procedure.
All right, so here's the deal. It takes about 2 weeks to see the benefit. And, you know, we are a little skeptical of all these ideas, so we wanted to really check this out. So I have some pictures before and afters of this device being used. Are you curious to see them? Yes. Okay, so here's a picture. This is an image of someone's belly. You see the before on the left and the after on the right. This is after 2 weeks of using the device. And let me have the side view, if you don't mind. And that's a big difference. And that's pretty typical of the patients you see?
Typical.
Typical.
Yeah, we guarantee 3 inches at least.
You guarantee 3 inches?
We guarantee 3 inches at least.
That's a pretty good deal. Catherine, what do you think?
Woohoo!
All right, here's the deal. We're not going to keep you here for 40 minutes, but we have gotten a promise from Dr. Esper. She's going to take you to her office, and she's going to finish 6 therapies for you to get you, maybe those 11 inches that we can get off you. That's good. Thank you very much. Catherine, thank you very much.
Thank you.
All right, we'll be right back, everybody.